Welcome everyone to our January webinar with Senator John Hoffman and Senator Jim Abeler. We're going to be discussing bipartisan approaches to opposing assisted suicide, which is timely considering that the legislative session is going to begin shortly at the end of this month. Wanted to talk a little bit about the Alliance. As most of you may know, if you are returning to our webinar, and some of you that are new may not know, we are a nonpartisan coalition of about 100 different organizations, including medical providers, healthcare providers, mental health organizations, veterans groups, disability rights organizations, faith-based organizations, and many others working to provide compassionate alternatives to the legalization of assisted suicide here in Minnesota. So we will talk more about that and learn more about what's happening on the legislative front. I'm Lynn Varco with the Minnesota Alliance for Ethical Healthcare. I also wanted to introduce Elizabeth Emerson, who is going to be co-hosting this webinar with myself. Elizabeth is our main lobbyist at the Capitol, and she's going to talk just for a second here about who she is and what she does.
Thank you, Lynn. Hi, everyone. Thanks for joining. My name is Elizabeth Emerson. I am the Vice President of Public Affairs for Goff Public. Goff Public is a public relations and public affairs firm here in St. Paul. We've been in business a little over 50 years and kind of really working at that intersection between what's going on in communities and at the legislature. So I'm happy to be here and look forward to the conversation today. Thanks, Lynn.
Great. Now I want to introduce our two guests and the topic they're going to be talking on. Senator Hoffman, I know, is going to be coming from another engagement, so might be joining us a little bit later. Senator Hoffman is a member of the Democratic Farmer Labor, the DFL party, and was first elected in 2012. He represents Senate District 36 and currently serves on Human Services Reform and Aging and Long-Term Care Policy Committees. Before being elected to the Minnesota legislature, Senator Hoffman served as a member of the Anoka-Hennepin School District Board in 2005. Prior to that, he was appointed to the Federal Interagency Coordinating Council, which advises cabinet members on public policy for children and families with special health care needs. Senator Jim Abeler is a Republican who served as a state representative from 1999 to 2015. In 2016, he was elected to the state Senate to represent District 35 and now serves as chair of the Human Services Reform and Finance Committee. During his time in the legislature, Senator Abeler provided state and local leadership as he advocated for his district and the state of Minnesota, especially as it relates to families and persons with disabilities. So with that, we are going to begin our discussion about bipartisan commitment that both Senator Abeler and Senator Hoffman have to advocating for people with disabilities and ensuring that Minnesota healthcare policy upholds the dignity of all individuals. And in particular, we're going to focus on the inherent discrimination and ableism of assisted suicide laws and why their legislative coalition to oppose legalization of assisted suicide in Minnesota transcends party affiliation. So with that, Senator Abeler, and I do see Senator Hoffman now on the call. Thank you so much for being here with us. Maybe we'll just start. If both of you could outline your history of bipartisan opposition to assisted suicide. I know you each have a story about why that is, and we'd love to hear that. And then I think we'll have Elizabeth talk a little bit too about the legislative process and how that influences how this pending bill rather makes its way through the legislature. Senator Hoffman, would you like to begin?
Absolutely. I was watching you present, and I was just like the only one in here, and I'm going, I'm here, but I'm not here. It's just this, over my head, Zoomish, Years ago, you had mentioned I was on the Federal Interagency Coordinating Council, and I had the pleasure of working with a little gentleman named Jim Ramstad. And I'll never forget the first time in the Rammer's office, he said, you know, Hoffman, and your appointment to this means a lot. And, you know, you're going to have to do some, you know, advising and assisting. And he said, just remember this, that when it comes to education and health and human services, that it should be a pragmatic, common sense approach, and that politics should be left out in the hallway. Matter of fact, you should leave your ego in the hallway. And it resonated in my head, Lynn, from that moment forward. And, you know, watching then Representative Abeler work in the House, I was absolutely blown away at how this guy was, you know, transcending all the political, you know, processes of oh, you got to be partisan on stuff, and really looked at and focused on the issue at hand. So I think that was a natural segue into working with. I've known Jim for 20 some years, and you know, it's just one of those things. You see the good, you see the bad, and at the end of the day, you do what's right for people. And I think there's a misconception, right? What brings me into this is there's a misconception out there that people with disabilities can't lead normal lives. Well, define normal. The last time I looked, it was just a cycle on a washing machine, right? And so just because a person has a disability doesn't mean their life is less, you know, productive or valuable or happy, right? And I think there's where your ableism comes in, because society really looks at the physical ability and it stigmatizes people with disabilities. And you know, a person is a person is a person, period. You know, we all have our own stuff coming into any kind of conversation. So I think that the history of listening to Rammer talk about leaving, you know, your ego in the hallway to really looking at focusing on what's right. And, you know, it's time we start treating people like people.
Senator Abeler, do you want to talk a little bit about your bipartisan approach on this issue of assisted suicide and how that's influenced how you work across the aisle?
Well, absolutely. And thanks for having me. And it's, you know, in a world where people think that politicians just fight each other all the time and, you know, try to always get their best advantage, this is a topic that should not be the least bit partisan. Life is my highest value. And who's ever got one deserves a right to keep it. And, you know, the topic of assisted suicide, there's so many like, oh, in this case, this person, we really should, you know, help them be relieved of their pain. But it doesn't stop there. John and I have talked many times about a place called Hadamar, where the Germans made it simple. They just sent all their people to there, and then they experimented on them and sent postcards back about, hey, your kid's having a great time at Hadamar. And actually, he was probably already deceased. And so in today's paper, there's an article about this matter about Scott Quiner. It says, difficult choices must be made when death approaches. And if people think that this stops with the person with a compelling story about their misery and tragic existence, no, we're short of beds. If you read this article, it says, when you're short of beds, let people go. Pull the plug. Mercy Hospital in my backyard in John's district, 2 blocks from where I grew up, went to court to file documents about being allowed to pull the plug and continue with the medical care plan, which was death. And so this is today. And I'm not aware that Mr. Quiner had any disability, but you can understand how that you move the goalposts. It's not hard at all. Well, they've had a good life. So this is so timely and so important. And we planned this some time ago, and here it is today, just on the day after, a few days after this whole thing has kind of blown up. So the people, you all watching, have a great hand in how this turns out. If you're quiet, we're going to get it someday. Senator Hoffman and I can hold back the floodgates in the short term, but new elections come, new groups take over. Somebody with a position, you're one amendment passing into law to allow this to happen. That's how the process works, and we'll talk about it. I am so pleased to be here and so glad to be part of the debate, and welcome everybody who's going to take it on with their own, take it on their back, because the life you save may not be your own, but it may be somebody, you know, in a different part of the country that you'll never meet. And that's really gratifying, I think. So thank you.
Thank you for that introduction about how the importance of working in a bipartisan manner, especially on the issue of assisted suicide, is so important. Before we have Elizabeth talk more about the legislative process and unpack that with both of our senators here, I want to remind folks that we have the Q&A function at the bottom of your screen. You can enter in questions if you'd like, and we will ask those as we go along in our discussion, which is set to go to 12:45. So we have about a half hour left. So please get your questions in early, and we'll make sure to get them asked of our panel here today. Elizabeth, do you want to talk a little bit about the legislative process after a bill like the assisted suicide is introduced, where it goes, how it works, and how we work with our esteemed legislators here today to make sure that our case is heard as the Minnesota Alliance for Ethical Healthcare?
Absolutely, thanks. And I will say I really appreciate Senator Hoffman and Senator Abeler's words. What brings me to working on this issue is also a very personal connection to this issue, not based on physical ableism, but financial ableism in a situation that my family was in. And I cannot think of two better people to be on this call who have worked tirelessly to make sure that both the financial resources are available for people, but also the policies are available to help people live their best lives. And so I very much appreciate that they're here today. From a legislative logistics standpoint, this is probably the least interesting portion of our day here, but incredibly important. Once a bill is introduced, there are several kind of routes of gymnastics that need to happen. As you go into any legislative year, legislative leaders set guidelines for timelines, and that kind of determines the cadence of the session. So there'll be policy bill deadlines, finance bill deadlines, and a bill such as physician-assisted suicide would need to meet the first policy deadlines. Now, that is in an ideal kind of schoolhouse rocks, how a bill becomes a law scenario, that a bill would be heard in the House in a policy committee. Then it might be rolled into an omnibus bill, and I'll touch on that in a little bit. And then it would go to the full House for a vote. It would need to have the same process in the Senate. Unfortunately, the real world doesn't exactly work like that Schoolhouse Rocks taught us. And so to Senator Abeler's point, there could be amendments adopted on omnibus bills, which have become an increasing trend at the legislature, meaning that lots of semi-related issues get dumped into one bill. So it's often a health and human services bill. And at any time throughout the committee process, a member could offer that amendment. And depending on the makeup of that committee, an amendment could go on. And then, of course, at a subsequent committee or on the full floor, there would have to be action to take that off. So we are monitoring the entirety of the legislative process because there are several opportunities that could exist for an issue like this to be tacked on. In terms of this legislative session, I think it's important to note that, traditionally this is a nice to have, not need to have session where bonding and policy might be addressed. However, I think many folks are aware there's a tremendous historic budget surplus on the table. So I think that the feel of this session will be a lot more similar to a full-blown legislative session. You layer that on top of kind of the politics associated with redistricting. Lynn mentioned caucuses coming up. Legislators will be having new district lines drawn. They may be paired against their colleagues of their own party or of an opposing party, which then kind of set their sights on November. And the urgency or the need to do things to appease kind of their base in order to turn people out in November certainly will be there. Only to say that I think there's many ripe opportunities to move a discussion on physician-assisted suicide forward. There are a lot of things on the table, though. And so I don't know that at this time, it rises to that level. But we often say the legislature is apt to stay away from issues that are incredibly costly, controversial, or complicated. And so to the extent that we can continue to remind legislators that physician-assisted suicide checks all three of those boxes, that goes a long way to not satiating the appetite to want to move it forward. So I think your continued involvement and telling your story to legislators, sharing those personal stories is the most effective thing that can be done on this issue.
Thank you, Elizabeth. And building on what she just said, Senator Hoffman and Senator Abeler, can you talk more about how protecting the choices of a few by legalizing physician-assisted suicide actually endangers healthcare for all of us. And in particular, Senator Hoffman and Senator Abeler, you've been passionate advocates for people with disabilities and those who are vulnerable. So do you want to unpack that a little bit more from your perspective, how you see that?
Go ahead, John.
Thanks, Jim. One just has to look. In 1978, the federal government established the National Council on Disabilities, right? It's a legislative body, right, that exists. And the NCD, National Council on Disabilities, did this snapshot, deep dive into the states that are doing that are letting assisted suicide happen right now, including studying a 20-year study of Oregon. And here's what they found. Jim is absolutely right on the fact that when you start to loosen existing safeguards, right, then you start to see over time they expand. And in the case of Oregon, they've expanded to include many disabilities, right, when properly treated, do not result in death. For example, arthritis, diabetes, and kidney failure, right? They expanded those kinds of things. The other thing that happened was the report also did some safeguards. It looked at some important safeguards. And that's where I really come into this battle in what we've seen come forward. There are no due process rights. There are no safeguards in place. And so, for example, the biggest safeguard that needs to be in place, the HMOs really care about you, right? Bottom line, and I'm sorry if there's somebody on an HMO on this call, but I was trying to be facetious, but insurers have denied life-sustaining medical treatment and instead have offered subsidized lethal drugs that potentially lead patients to hasten their own deaths. I mean, that's an actual quote from the National Council on Disabilities. And so you start to think, the process might be good, but no, unintended consequences are occurring from this because that system isn't really thought of deeply enough, right? Hence, that comes back to those safeguards in place. And so, you know, the other thing, if you look at their assisted suicide laws and the danger to people with disabilities, that particular report that the National Council on Disabilities, it lays out specifically why this is not a good idea, right? And so that's the thing that gets me is there's also in that report, there's lots of misdiagnoses of terminal diseases that cause frightened patients to motivate their death, right? Coming back to how do we value a human life? How do we value an individual? And so I think that's one of the biggest spotlight issues for me is all you have to do is look at the National Council on Disabilities and see their in-depth report that does it. And then while you're at it, Jim mentioned Hadamar. Our Minnesota Governor's Developmental Disability Council absolutely has on their website. It's it is absolutely the forgotten Holocaust. How did that start? It all started, as Jim said, that, you know, the state came in and said, oh, you know, we're going to take care of your child who has a disability. So they sent them to places like Hadamar. They'd go in the front door and they'd immediately do whatever they needed to do. And then a couple of weeks later, you know, the parents would get a note that said, oh, your child died of whatever. They'd make it up, right? Well, no, they were absolutely doing just this absolute wrong thing to individuals. And nobody was doing checks and balances on it at all. So due process, proper safeguards. What are we really trying to do here?
Yeah, I think the National Council on Disabilities is a great resource to encourage all of our listeners today to check that out. Thank you, Senator Hoffman, for that. Senator Abeler, do you want to talk more about how protecting the choices of a few by legalizing assisted suicide can endanger healthcare for all of us and how that plays out in the space that you work in?
Well, sure. And I just, while I was sitting here, I just thought I'd look up the Netherlands. Where this has been a growth industry. There were 1,800 assisted suicides in 2005 or one or something, and then 4 times that many. And in the Netherlands, they even talked about 7 children by agreement of the parents. They even mentioned infants, young. I don't know if it's infants or 1-year-olds. I just was skimming this. I'm not versed on this, but I knew this was a problem, so I thought I'd get a little bit of content. So if that 1-year-old has a deformity of some kind that's just considered to be, you know, incompatible with a good life, they can terminate that, which is exactly the topic that you're worried about. You know, some disabilities show up later, but some are obvious and like, oh, well, we don't want that one. Or the parents are like, well, we're pretty busy. Let's try again. it's the doctor and the parents agree, and then that's the criteria. This should be extremely worrisome. I cannot tell you how many. Well, I mean, I've not firsthand, but the parents of children with disabilities who have had the surprise event of like, oh, here's Tom and Sue. They're a little, we weren't expecting this, but then they work through that and they, embrace them and love their child immensely. If you would ask them when that child is 30 or 40, if they wish they would have done this when they were 1, they would throw something at you because they dearly love their child. The child has grown in their own appreciation of life. They have a great life and they enrich the people around them. And so this absolutely is on the track where things are going to go. And in a time of limited resources like today's paper, you can understand the pressure it's going to go. So that's compelling. If you're not convinced that you should worry about this, just look up Netherlands assisted suicide and you'll find 50 links on how it's going. And in many cases, that's considered success. That is not success. That is tragedy. It is a new little mini potential Holocaust, and Elizabeth was talking about the legislative process. Well, Senator Hoffman, there was this actually came up to the legislature a few years ago. Was it 2013 or something?
2014.
Yeah. And
Yeah.
I remember the hearing, and I remember that in that hearing, John was the swing vote to have it not happen. And then it died in committee. And he loves to say, do the math, better learn to count. But so there was bipartisan opposition, and you don't know where it would have gone had it got out of that committee. And so, eternal vigilance is the price of freedom. And so John and I are there. We're not going to be there forever. But the people on this call, it is your vigilance and the vigilance of people you teach. You better watch out. You better make sure this is too hot to handle for some of the people that you like. Maybe you like one part or the other on a certain topic, but this one you don't like them on. Remind them that this is not something you're going to tolerate, and they better stay away from it and just let people live. It's a right to live.
And Jim's knocking on something, Lynn and Elizabeth, too, that, he talked about services and supports. Well, if you go back to the National Council on Disabilities, they found, this is key. The most prevalent reason offered by someone requesting assisted suicides are directly related to unmet service and support needs, period. Whoa. So everything we're doing, and I saw some questions, some comments in the chat about that, right? It's like, yeah, they're absolutely right on, spot on. Just this morning, Jim was in a meeting with the commissioner about, giving some supports to the group homes, giving support, and I was listening, and it's like, yeah, this is something that we need to do. That reaches that where the unmet service and the support needs need to be. It all starts in those little pieces right in there, and they're all related.
I think both of you have nicely captured the issue of ableism in healthcare and how legalizing physician-assisted suicide would just exacerbate that. And I think Minnesota has been such a healthcare leader for so many decades that assisted suicide is not really a value that I think our citizens would want to uphold at all. And there's also within healthcare, and Senator Hoffman, I think you were getting at to this, is the issue of metrics that can be used to deny care, such as quality adjusted life years, which are really a big issue. And we actually have a question related to that, especially for older adults and how they face care in long-term care and some of the challenges in that area. And do you want to talk about how better hospice and palliative care can be a way to help our older adults in situations where they may be facing challenges in long-term care and other places, and how if we invest in that area, both on the access side and on the education side of providers, we can have more choices available, because at the end of the day, physician-assisted suicide really reduces choices, like both of you have so nicely discussed.
John, do you want to do that one first, or should
Yeah,
I?
I think, Jim, it has come, that absolutely is, why would this, in 2014, they brought the bill a couple of times, and then in 2014, you know, it was a hearing, and then they had another one in 2016 or 16 or something like that, right? But regardless, and Jim, you know, jokingly says, yeah, you got to do the math, but really, if I wouldn't have been in that committee, it would have passed. That one, it was the deciding vote, and that would have just kept moving along the spectrum of hearings. And Elizabeth knows this. Once it passes one committee and it goes to a next, it's harder and harder to absolutely stop that thing from happening until it comes to the floor and then the debate. But twice, and the author of the bill actually stormed out of the committee. And so that is just, you know, something that I come back to. They want to create a brand new statute rather than working through the system that currently exists, right? And Lynn, you touched on that. Why aren't we really, you know, spending time and effort looking at how we can make things more comfortable for people, make things, you know, utilizing what's existing in statute versus creating this whole new carved out statute, which is, you know, it's like this model. You ever go in your kitchen, you open up your kitchen cabinets and you see the beans are over here and the green beans are over here and everything just doesn't make sense. That's kind of like, you know, sausage making at its finest. And that's what you look at legislation, you go, well, why is this term mentioned 15 times in 15 other state statutes? Because somebody put that can up here and then put this can over here. And there never is a conversation about what the system's about. And in this case, Lynn, you're getting on it. What are we doing? Especially the fact that the first time in history, 65 and older, we have more people that are 65 and older in Minnesota than we do in our K-12 education system, right? 1 in 5 people live with a disability in the state of Minnesota. It's 25%. And that breaks down to everything from, you know, asthma all the way up to a chronic condition that's lifelong, right? 10%, 1 in 10 people actually live with a chronic condition right here in Minnesota. So it's going, why would you just pluck this out and put another can up in your kitchen cabinet when you should be really looking at what other things are there that we should be able to do and enhance somebody's life, not destroy it?
Senator Abeler, do you want to talk about
Sure.
other interventions such as hospice and palliative care that can be deployed to expand the menu of choices for people at end of life so we don't have to use physician-assisted suicide?
All this discussion of cans and menu is kind of making me hungry, but that's not really why we're here. So what you have to do, what we all have to agree on is that life has value. I think every life has value. I think a 1-year-old has value. They're going to make a lot more money in the future than somebody who's 70 or 90, but that 90-year-old has value. And life is, you know, there's the circle of life from The Lion King, but I mean, you're born, you get old, and we're all going to die. But we don't know when. And I don't think it's for me to decide when anybody else's time is up. I think it's up for God to decide. And there are stories about people who suffered greatly at the last for a year or longer and like, oh no. But if life has value, then some money has to be spent on that life all the way through its life for proper care. And if options like hospice, my dad passed away recently. He died on Veterans Day. He always wore a hat for the carrier he flew off with his wings on it. It was just kind of beautiful. He was 97. He was totally ready to go. He didn't need heroics, didn't want them, and it didn't matter for him. And he died peacefully in his house. And, you know, death is not something any of us are probably eager to get to, but it is a fact of life. And I think if he would look at his life, he would have been happy with how it ended, with his family around him as he slept his way out. What if somebody would have decided, well, you're 95, you're going to consume a lot of resources and let's just take you, you know, that means he has no value. Even at the very end, when he's sitting there unconscious, sleeping his way, those conversations we all got to have where we looked at him and he heard us or not, had great value because he was still alive. And we could still say things to him, read a psalm or whatever, and sing a song or something. But life is valuable to the very end. And that means if you're going to provide palliative care where they can be more comfortable, not just to knock them out, you know, but just to make them as comfortable as they can be so they can enjoy conversations with people, finally sitting down and having those moments. And that we decide as a society that that's got value. And we put money into it. We have nursing homes, and hopefully they're, nobody wants to go there, but they should be nice and they should be respectful, and the people should have a good service level there, and options available. And when finally it's time, where do you want to do your hospice? Do you want to be in a nursing home? You want to be at home? You want to be in a wing somewhere that's kind of friendly? It's all a statement of our value. And if it's simply about money and resources, and some of us should not have even been born because we've not provided enough value to the country somehow, and that to me is intolerable. And so life has value, and it's worth this much, and your life is worth this much. Mine is, Senator Hoffman's, all your people watching is worth this much, a lot. We're all the same. And so that's why, John and I work together and trying to help people with disabilities and general programming to give them more independence, more freedom to live a life to the capacity that they can have, and help support those who need more supports. But it goes back to value. And I think if we declare that, it's hard to lose that argument. In the Netherlands, some people at 70 are allowed to terminate their lives because they're just tired. Wow. That's tragic to me. Anyway, thanks.
Yeah, I want to thank both of you for outlining this model of bipartisan support. And I also want to thank you for putting it into action on the issue of hospice and palliative care, and co-authoring the Palliative Care Advisory Council effort to fully fund that. That is an effort of the state to study and learn how we can improve access to exactly what we're talking about here. So thank you very much for that. We have a question here about how the healthcare system itself can influence end-of-life care related to staffing issues. So here's the question. It's been well documented that rates of burnout, including suicide, are among the highest with medical professionals. Given that this is but one extremely disconcerting sign of our broken healthcare system, how should this reality inform the public debate over physician-assisted suicide, or is it a separate issue alone?
Oh, go ahead, John.
I think it's all interrelated, Lynn. I mean, our problem in Minnesota is, we're county by county by county. We're siloed. Everybody has their turfs. Everybody has their silos, right? And if we truly want to look at a system, you got to talk about integration. You got to talk about, intersectionality, right? When you hear the comments about, we got to do this or do that, right? A lot of times people with disabilities are always left out on the side, and there's no intersectionality coming into that conversation. And so, no, I think if we're going to put a value, we value human life in the sense of, this is meaningful to how we do. It all has to be talked in the greater collective. It all has to be talked in the systems approach, because you might say, and this is where the argument right now, when folks would call and say, I'm opposed to you being opposed to end of life options, right? Compassionate care, or whatever they market to determine what this is called, right? And you say to yourself, this is my individual. This individual coming to me is from their lived experience individually. This is their subjective reality, right? But one person's subjective reality doesn't necessarily address the whole system. And in the whole system, you have all these different lanes and different turfisms that you got to look at, right? And I'm talking, you got to integrate that conversation. I mean, it really is a governance model versus a individualized, anecdotal model. And so I think you got to have that conversation, Lynn. And this is just how my mind thinks on the collective. I think you got to have that as an integrated approach. And before Abeler says it, 1986, this federal government said early intervention services must be coordinated, collaborative, and comprehensive. So 3 C's there. I added 3 C's back to you, Elizabeth, that you can use. So I had to get federal law there, Jim.
That's really good. Give us another question. Time's moving along here.
Sure. There's a question here about the Oregon law and some of the issues with that. And I think it touches on something that Senator Hoffman said earlier about the reason people choose assisted suicide. In Oregon, the number one reason that people choose it based on their data is fear of being a burden to others. And in many of those cases, there are clear mental health issues, but there's no mental health evaluation that's required before someone would choose assisted suicide. So do you both want to talk about some of the loopholes in the mental health area related to these laws and concerns that you see in your experience as legislators?
Well, just in brief, I'm not as versed on Oregon or just reading the Netherlands stuff. It's just a bad idea. It's a bad idea. So you're having a bad week, a bad month, a bad year, and I want to give up. How many people have just had really bad periods of time, and now time has gone forward, and you fast forward, and your things are looking much better. So to let somebody in the moment of despair decide, I'm done. I mean, they can always go do that. I mean, people do it all the time. There's way too much regular suicide. Now, never mind, you get medically assisted stuff. So just a bad idea. I'm just going to stick with that.
In the comment, I'm a burden. Come on. I mean, seriously, I'm feared because I'm a burden. So now you're placing value. I mean, it gets back to the whole conversation, Jim and I have been about, right? How do you value that person, that individual person? And the other thing is so you start to look at people with disabilities as a burden on the system. Now we're back to the Hadamar argument. We're back to where we were in the 1930s, and it's just absolutely terrible, just absolutely systemically terrible.
And beyond that, once you get this law in place, a little mini version of it, it's going to expand. Well, what about this guy? And what about this woman? Look at this case here, how miserable they must be. So that's the Netherlands story. So you got to look at what's going on. And it's nothing I'm about. Life is valuable. Everybody has life. Everybody's equal. Let them live.
Yeah, Senator Abeler, you're right about it's not really a slippery slope, but a slippery cliff, and how the laws expand. So now several states are moving to a 12-month prognosis instead of a 6-month prognosis, and they're also expanding the eligibility of cases for assisted suicide. So it could be Alzheimer's or dementia, and it could be eventually other people. It could be children or others as well. We have a question about the pandemic. The COVID-19 pandemic and the issue of care triage has made issues of assisted suicide an urgent issue and considered an opportunity to demonstrate the need to question whether or not we really need physician-assisted suicide to adequately deal with limited resources. Do you want to talk about that issue of how the pandemic has maybe exacerbated some of the healthcare limitations we have, and maybe even made it more challenging for people with vulnerabilities who are at risk? And if assisted suicide were legal, it would be perhaps easier to put those individuals at risk into a category.
Today's Star Tribune, read the editorial. Difficult choices must be made when death approaches. Basically, we need the beds. And so this is not assisted suicide. This is today. This is an unwilling person who is going to be allowed to die. Actually, they're going to unplug him so his medical care plan can be completed, which is no treatment, with which he will die. This man is in Texas. He's actually improving a little bit. So this is a case that it didn't happen to this. This is happening in countless places across the country today because of someone's decision. This person, they're alive and they're going to pull a plug and they are going to be dead in a matter of minutes or hours. It's real. It's today. If you don't, you think it's only people with disabilities or assisted. This is, the medical system is not waiting to ask you. They're doing it now. You had better worry. You'd better push back on this. And Mercy Hospital is an otherwise nice hospital. They do a lot of good things. But this is what happens when decisions are made by boards and by national agencies and entities. The doctors here didn't decide this. This is decided by protocol from JCO or Dr. Fauci, I don't know where, but this cannot go on.
And Jim, you start to get on the whole idea of, Hadamar, it wasn't the legal system that created it, it was the medical system that created that, right? So thank God we have judges in place. Thank God we have a balance of power, but why do we have to go there with that, right? And if you give HMOs, going back to, I'm not going to put on the formulary this expensive pill so it keeps you from having acne, or whatever it is, right? Rather, I'm going to say, here's this less expensive pill, because the bottom line is the bottom line for those organizations, right? And that's sad. That sends a sad message to us. And let me ask this, Senator Abeler, how much control do we have over the healthcare plans in Minnesota as legislators right now when we try to move something? What's it like to try to change something within that HCA healthcare administration side of our world?
Glacial. It's really hard. It's really hard. There's so many different fingers in the pot. And we tried, but so the people have to care. And you have to, it looks like we're almost out of time. The people on this call, tell your friends to care about these matters and make them a priority. Ask every person who knocks on your door or wants your vote, what are you going to do about life? Is life important to you? Well, there's difficult choices we'll have to make. Hey, no. The only choice I'm going to have is how are we going to pay for the importance that we're going to hold each person in? And because they have value. My grandma, who's now gone, she was 107 when she died. She had value at 106 and a half. Not according to these people. We got to change that dynamic. And that comes from everybody here. Thanks for letting us do this. And God bless you all as you fight the fight. It's well worth it. The life you might save, maybe the life of your kid when you're gone. You just don't know.
I think we have time for one final question. I know we're kind of at 12:45, but maybe Elizabeth and Senator Hoffman, Senator Abeler, if you want to just take 30 seconds, we have a question about what's the best way for the average citizen to get involved in this issue and to help influence better policy so that we can oppose assisted suicide. Elizabeth, do you want to say something real quick and then pass it off to Senator Hoffman and Senator Abeler for closing thoughts?
Sure. I think, from my perspective, talking to your legislator when there isn't something directly in front of them, when there's not a bill directly in front of them. So starting those conversations now and then continuing them, right? This is so developing a relationship of trust. I think certainly providing your thoughts not only on physician-assisted suicide, but other investments in palliative care, offer yourself as a resource, but that personal story and then building a long-term relationship. So you're not just dropping in with an email, you're building a relationship of trust with that lawmaker.
Great advice, Elizabeth. Thank you. Senator Hoffman, do you want to say 30 seconds what your take is on that as a sitting legislator?
Yeah, I think Elizabeth termed it well. In the real estate world, they talk about the three big things are location, location, location. In the policy world, it's relationship, relationship, relationship. You absolutely go out and meet and greet and become, that expert for that relationship building with your local elected official over time. Yep.
Great. Thank you, Senator Hoffman. Senator Abeler, do you want to say some quick
Sure.
thoughts on that as well?
And you mentioned the precinct caucuses are coming up Tuesday, February 1st at 7:00 in every city of every state, of the whole state. All of you should go. Pick the party that you like the best. I don't mind which one it is. I may well be that your group could give a sample resolution to all the attendees that they should try to pass. It may or may not pass, but it'll create a discussion, and it will pass somewhere in each party. And then now the leaders have to deal with that. I assure you, the assisted suicide people are doing the same thing. And so at least you want to create a discussion and make the point, each party should decide that life matters. And if you get that in the platform and these discussed on both sides, it really messes up the opposition who want to decide that someone's life simply does not matter. So Godspeed.
What a fitting way to end our webinar. Thank you, Senator Hoffman and Senator Abeler and Elizabeth Emerson. Thank you, everybody. And we will see you again soon.